I'd like to introduce Dr. Menon. Dr. Menon is the Medical Director of Liver Transplantation in the Department of Gastroenterology and Hepatology at Cleveland Clinic. He has completed subspecialty training in advanced endoscopy and hepatology. He's an assistant professor of medicine at the Cleveland Clinic Lerner College of Medicine of the Case Western Reserve University. Dr. Menon's specialty interests include liver transplantation, liver and bile duct cancer, advanced endoscopy, and advanced liver disease.
Thank you. So, thank you. Thank you all for coming and staying back, and I hope you've enjoyed your stay in Cleveland and at the Cleveland Clinic. So, our first part will be Mel and UNOS. Donna Furchell is our transplant nurse manager, and Julie Pleska from our local OPO, which is Life Bank. So can I have them both come up? Thanks. Okay, so Donna is going to go first, and her title will be Mel Score, Listing for Transplant and Organ Allocation.
Good afternoon, everyone. Okay, so the objectives of our talk, I'm just going to go over briefly what a MELD score is, although I think yesterday from being here, I think pretty much all of you know what that is. We're going to talk about PSC patients, and they typically have low MELD scores. Listing for liver transplant, exception points, dual listing, role of the OPO, which is our organ procurement organization, Life Bank, UNOS, which is our national waiting list, and then finally organ allocation and placement. So just a quick overview regarding MELD. The model for end-stage liver disease is a reliable measure of mortality risk in patients with end-stage liver disease, so for all liver diseases. It is used as a disease severity index to help prioritize allocation of organs for transplant. So this is what we use when we list patients. The MELD score ranges from the lowest score of a 6, which means you're pretty well, all the way up to a MELD of 40, which means you're very sick and needing a transplant very quickly. The way that's calculated is we use the following lab scores. So we use your kidney function, your serum creatinine, your bilirubin level, your INR, which is your clotting factor, and your sodium level. And I have an asterisk next to the creatinine because if you are on dialysis, you do get a higher MELD score. Typically, PSC patients often have low MELD scores, and they do not reflect how sick these patients are. So again, the MELD score just is basically what your lab work shows. That's your chemical MELD score. So PSC patients usually have complications of liver disease that do not reflect what the MELD score truly should be. So usually you have low MELD scores, 12, 13, 14. It doesn't reflect if you have encephalopathy, ascites, varices, and things like that. So often you're a lot sicker than what your MELD score reflects. So I'll just briefly review what this listing for a liver transplant means. Every center does it a bit differently. Here at our center at the Cleveland Clinic, you're usually referred over for a formal liver transplant evaluation. It can take anywhere from 4 to 5 days to complete that. Then we get you reviewed at our liver transplant selection committee, and if we have found that you are a candidate for transplant, at that point in time you will be listed for a liver transplant with your chemical MELD score and by your blood type as well. Dual listing. So just wanted to mention, in case any of you do not know that, you can get listed at other centers. So UNOS does allow for you to get listed at other centers of your choice. But one thing I would note to all of you is that you have to make sure your insurance company is willing to pay for an additional evaluation at another center. Exception points. Some patients with PSC are awarded exception points to increase their access to transplantation. So what that means is if you have cholangitis, so an infection in your bile ducts, and you are admitted into the hospital and you receive IV antibiotics approximately 2 to 3 times in a 6-month period, you may be eligible to receive an exception. So what that means, and I'll show you on this next slide here, is we are divided up by regions over the United States. There are 11 total regions that UNOS has divided us into. So we're in region 10. So for example, if we have a patient that we listed with PSC that has recurrent cholangitis, we can submit an exception to our regional review board. So it would be region 10, and it would be up to them to award you those exception points. They're good for about 3 months, and then the coordinator has to resubmit again for you to continue to get those exception points.
Donna and I have worked and known each other for quite a long time, but we didn't plan the outfits today. So in case anyone was wondering, that wasn't planned. My name's Julie Plesha. I'm with the Life Bank organization, which is one of the organizations that I'm going to very briefly talk about today. Life Bank is Northeastern Ohio's organ procurement organization, or OPO. So there are 58 OPOs across the country. We cover every single corner of the United States as well as Puerto Rico. It's an independent nonprofit organization, and what we do is we coordinate all of organ, tissue, and eye donation throughout the country. So our mission is to save and heal as many lives as possible through the gift of organ and tissue transplant. So UNOS is the United Network for Organ Sharing. So this organization is located in Richmond, Virginia, and this is our governing body. They create all the rules in regards to allocation, how our lists work, how patients are listed for transplant. They also manage the nation's organ transplant system, or the electronic database that is used to facilitate the organ allocation system, or the offering of organs. So we all use this database to make sure that all of the OPOs throughout the country, as well as the transplant centers, have access to UNOS database to make sure that the most critical patients are getting transplanted. So organ allocation, or placing organs for transplant, a lot of patients on the transplant waiting list, they want to know where their organs are coming from. So in general, the rules are established to make sure that the most critically ill patients are receiving the transplants. So in regards to liver transplant patients, your Mel Score is super important, because that's going to depict where you're going to fall on the waiting list. So the higher your Mel Score, the closer to the top of the list that you are going to be. So the quicker, most likely, you will be transplanted. So that's why it's largely important that your Mel Score is monitored frequently by the transplant center, as well as those exception points that Donna talked about, and how if your Mel Score is around 14 and you're able to qualify for exception to move up to a 22, then your likelihood of getting transplanted is significantly increased. So each organ is different. There's different criteria that needs to be met. So heart patients don't have a Mel Score that are waiting for heart transplant. Lung patients are listed in a different way. So the Mel Score is specific to liver patients. Organs can be split, so one liver can save 2 lives, and that is actually a huge advantage for patients that maybe are smaller and have a lower weight, and there's a larger donor that comes up on the list. That liver can be placed with 2 different patients. So briefly, before I get into this need here, so how does the whole allocation process work? Is that literally a click of a button. So at Life Bank, we have family support liaisons that are out there offering to over 80 hospitals, when a potential organ donor is identified, the opportunity for their loved one to be a donor, or if they've made the decision themselves to be a donor, we're going to help to facilitate that donation. So our clinical coordinators are on site, and they're clinically managing the organ donor in the ICU of the hospital. And we wait until that moment when everything is gathered on the donor that we could possibly have gathered, to make sure that we have all of the information and we're ready to place those organs for transplant. As you can imagine, your Mel Score can change, any day. So somebody may be a 20 one day and then move up to a 24. So we wait till that last possible moment to make that offer, because we know any patient can be added at any time from the transplant center. So everything is electronic, so we press a button and everything is electronically notified to the transplant coordinators. So the coordinators that work with Donna are receiving an offer saying, we have an organ offer for you. And at that time, the first patient on the list is going to get that offer first. It's a numerical order, goes 1, 2, 3, 4, all the way down to 300, 400, 4,000, 5,000. Our lists are many pages at times, depending on the organ. Also, blood type plays a huge role as well. So the primary patient that's coming up for that offer is going to have first opportunity for the organ, And so the transplant center coordinators are going to work closely with their hepatologist, with the liver surgeon, to make sure that that's the best fit for that patient. Size is the best example, that even if you're patient number one on the list, that organ might be too big for you. So there's a lot that goes into planning that organ recovery, and at LifeBank and the other OPOs, we work our way down the list until that organ is placed with the recipient. So this is the reality here on this slide. So these are numbers just from yesterday, so you can go on the UNOS website at any time and see how many patients are listed for transplant, so well over 100,000. This is a list we're never going to get down to zero. There's always going to be a need. And as patients, the transplant track it may be the best track for you to follow. However, I think just in this brief time that I've been here, just listening a little on the last talk and about PSC partners in the organization and looking for other methods of treatment and research and helping your symptoms, I think that's so largely important and actually really exciting, because we're not going to be able to transplant our entire list. So this is why it's so important that we're making sure that the sickest patients are getting transplanted. The future looks really great, though. Last year was a record-breaking year for organ transplants across the country. This is a number that's been relatively stagnant, but has definitely seen an increase after last year. So over 33,000 transplants were done last year, and it was in the news this year. We're very excited about it. So things are looking good as far as identifying organ donors and getting those patients that are in need of a transplanted. So that is all we have for you. I can't finish, though, without saying that in the work that my organization does, as well as the Transplant Center, we're very humble about what we do, and nothing is possible if it wasn't for our donor families and our donors out there. So thank you very much for the opportunity today.